ನಮಸ್ಕಾರ, ನನ್ನ ಹೆಸರು ಜಯ. ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಗೊತ್ತಿರಂಗೆ ಇವತ್ತು ನನ್ನ ಜೊತೆ ಯಾವ ನಕ್ಷತ್ರ ಇದ್ದಾರೆ ಅಂದರೆ ಡಾಕ್ಟರ್ ಗೌರವ್ ತಿವಾರಿ ಅಂತ. ಇವರು ಹುಟ್ಟಿದ್ದು ಬೆಳೆದಿದ್ದು ಛತ್ತೀಸ್ಗಢಲ್ಲಿ, ಮತ್ತು ಬೆಂಗಳೂರಿಗೆ ಬಂದು ಇವ್ರು ವೃತ್ತಿನ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ದಾರೆ. ಸ್ಟಾರ್ಟ್ ಮಾಡಿದಾಗ ಇವ್ರು ಡೆಂಟಿಸ್ಟ್, ಆಮೇಲೆ ಫೇಶಿಯಲ್ ಆಸ್ಥೆಟಿಕ್ ಸರ್ಜನ್ ಕೂಡ. ಈಗ ಕಾಸ್ಮೆಟಾಲಜಿಸ್ಟ್ ಆಗ್ತಿದ್ದಾರೆ, ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಿದ್ದಾರೆ. ಸೊ ಇವ್ರು ಯಾರು, ಈ ನಕ್ಷತ್ರ ಏನು, ಇವ್ರ ಬಗ್ಗೆ, ಇವ್ರ ಜರ್ನಿ ನಾವೆಲ್ಲರೂ ತಿಳ್ಕೊಳ್ಳೋಣ. ನಮಸ್ತೆ ಡಾಕ್ಟರ್ ಗೌರವ್ ತಿವಾರಿ. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಫಾರ್ ಬೀಯಿಂಗ್ ಪಾರ್ಟ್ ಆಫ್ ಅವರ್ ಶೋ. ಇವ್ರಿಗೆ ಕನ್ನಡ ಬರುತ್ತೆ, ಕಲಿತಿದ್ದಾರೆ. ಸೊ ನಾವು ಕರ್ನಾಟಕದವರು ತುಂಬ ಅಡ್ಜಸ್ಟ್ ಮಾಡ್ಕೊಳ್ತೀವಿ. ಸೊ ಕನ್ನಡದಲ್ಲೂ ಇಂಗ್ಲೀಷಲ್ಲೂ ಆದಷ್ಟು ಅವ್ರು ಟ್ರೈ ಮಾಡ್ತಾರೆ ಮಾತಾಡೋಕ್ಕೆ. ಸೊ ಥ್ಯಾಂಕ್ ಯು ಫಸ್ಟ್ ಆಫ್ ಆಲ್, ಟ್ರೈ ದಟ್ ಯು ವುಡ್ ಟ್ರೈ ಟು ಟಾಕ್ ಇನ್ ಕನ್ನಡ. ಸೊ ದ್ಯಾಟ್ಸ್ ಅ ಗ್ರೇಟ್ ಸೈನ್ ದಟ್ ಯು ವಿಲ್ ಬಿ ಪಾರ್ಟ್ ಆಫ್ ಅವರ್ ಕರ್ನಾಟಕ ಫ್ಯಾಮಿಲಿ. ಸೊ ಗೌರವ್, ಹೌ ಯು ಬಿನ್?
ಆದಷ್ಟು ಕನ್ನಡ ಬರುತ್ತೆ ಅಷ್ಟು ಟ್ರೈ ಮಾಡ್ತೀನಿ. ಸೊ ನಮಸ್ಕಾರ ಎಲ್ಲರಿಗೂ. ಐ ಆಮ್ ಡಾಕ್ಟರ್ ಗೌರವ್ ತಿವಾರಿ. ಐ ಆಮ್ ಪ್ರಾಕ್ಟಿಸಿಂಗ್ ಆಸ್ ಅ ಫೇಶಿಯಲ್ ಏಸ್ಥೆಟಿಕ್ ಸರ್ಜನ್ ಇನ್ ವಿಜಯ ಬ್ಯಾಂಕ್ ಲೇಔಟ್, Bangalore, ಫಾರ್ my clinic called as Bo to Cosm, and I run a hospital called as Trust Multispeciality Healthcare. Bangalore
ಹೇಗಿದೆ ಕನ್ನಡ ನಿಮಗೆ? ಯು ಗೆಟ್ ಡಿಫ್ರೆಂಟ್ ಕೈಂಡ್ ಆಫ್ ಪೀಪಲ್ ಕಮಿಂಗ್ ಇನ್ ಟು ಯುವರ್ ಕ್ಲಿನಿಕ್. ಆ್ಯಂಡ್
ಬ್ಯಾಂಗ್ಳೂರ್ ಬಂದಮೇಲೆ ಫಸ್ಟ್ ಥಿಂಗ್ ನನಗೆ ತುಂಬ ಕಷ್ಟ ಆಯಿತು. ವೆನ್ ಪೇಷಂಟ್ ವಾಸ್ ಟ್ರೈಂಗ್ ಟು ಟೆಲ್ ಹಿಸ್ ಪ್ರಾಬ್ಲಮ್, ಇಟ್ ವಾಸ್ ವೆರಿ ಡಿಫಿಕಲ್ಟ್ ಫಾರ್ ಮೀ ಟು ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್. ಸೊ ಸ್ಲೋಲಿ ಐ ಪಿಕ್ಡ್ ಅಪ್ some words from the patient, and ಆವಾಗ ಕನ್ನಡ ಕಲಿಯೋದು ನನಗೆ ತುಂಬ ಇಷ್ಟ ಆಯಿತು. ಮಾತಾಡಿ ಇವಾಗ ಸ್ವಲ್ಪ ಅಭ್ಯಾಸ ಆಗಿದೆ ಅಷ್ಟೇ. ಇನ್ನೂ ಸ್ವಲ್ಪ ಕಲಿಬೇಕು. ಬಟ್ ಅಟ್ಲೀಸ್ಟ್ ನನಗೆ ಪೇಷಂಟ್ ಏನು ಹೇಳ್ತಾ ಇದ್ದಾರೆ, ಅವ್ರದ್ದು ತೊಂದರೆ ಏನಾಗಿದೆ, ಅದು ಸ್ವಲ್ಪ ನನಗೆ ಅರ್ಥ ಆಗುತ್ತೆ. ಸೊ ಐ ಕ್ಯಾನ್ ಬಿ ಬೆಟರ್ ಇನ್ ಜಡ್ಜಿಂಗ್ ದೇರ್ ಪ್ರಾಬ್ಲಮ್.
ನಿಮಗೆ ತುಂಬ ಈಸಿ ಆಗುತ್ತೆ ಟು ಬಿಲ್ಡ್ ದಟ್ ರ್ಯಾಪೋ ವಿತ್ ದ ಪೇಷಂಟ್ ಅಲ್ವಾ? ಹೌದು.
ಸೊ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಕನ್ನಡ, ಇಟ್ಸ್ ವೆರಿ ಈಸಿ ಫಾರ್ ಮೀ ಟು ರಿಪ್ಲೈ and to communicate. I can better do.
It's a wonderful language. I'm sure you're going to love it.
Very wonderful.
So we're welcoming you to learn Kannada, and you will become a pro. Ati shigradalli you will become a pro in the way that you speak Kannada. Okay, so ನೀವು ಹುಟ್ಟಿದ್ದು, I mean, you were born and raised in Chhattisgarh, then you moved into Bangalore, and you've started your profession in Bangalore, and you're continuing to practice whatever that you've been doing in your profession, right? So you started as a dentist, and then you are a facial aesthetic surgeon too.
Yeah.
So what's this journey about, being a dentist to a facial aesthetic surgeon, now to a cosmo-dento, right?
Cosmetic dentist.
Cosmetic, sorry, not cosmo, cosmetic dento surgeon, yes. Right? So how has this journey been in?
See, when I started with my basic dental practice, we were doing cases which were relevant to most of the dental and the oral areas, and then I met somebody called as Dr. Ashish. He's my mentor and my guru.
Okay.
So I got to know about facial aesthetic from him, and there was very similarity between doing facial aesthetic and practicing dental surgeries. So most of our dental surgeries had limitations on correcting the patient's smile. Yeah. And even after doing a very good teeth restoration, we failed to correct the proper positioning of the lip. So I was not satisfied with all of my knowledge that I had to treat this patient, and even the patient was not satisfied after receiving maybe a 1-year orthodontic braces treatment. We used to see that the patient still has gummy smile. Yeah. So when I came to know about the use of Botox in gummy smile, that's where my first thought of starting with facial aesthetic started. That how can Botox or something like which we were hearing that it is a cosmetic procedure, Botox, but into dental practice I was never knowing. So this was my life changer decision, that how to use Botox in correcting gummy smiles and making the smile better. So this is where facial aesthetic started, and over the time there were multiple things that came off, like fillers, collagen threads. The patient was not satisfied with their nose position. Yeah. They were having confidence issue, not having good amount of hair on their scalp.
So I'm sure when people come up, right, they're very hesitant, right? So ಆ ಮುಜುಗರ ಇರುತ್ತೆ, because let's say that somebody comes for a hair transplant, right? I'm sure you would have got people, and they're today they're very what would I say, they're very hidden. They don't want to come out and talk about it, but there is, maybe it's low confidence.
I'll tell you two people that I have seen mostly with confidence lacking issue. First of them are having dental issues, that they are having a fractured tooth or a bad smile or improper positioning of the teeth. They forget to smile.
Yeah.
They forget
Which
to
is
smile.
a very important
Which
thing.
Which is a very important thing. If they just visit a dentist or a surgeon or a cosmetic dentist who can fix their smile, just by giving some time, they can make it much better. They can gain more confidence. They are very confident in speaking with public and showing their teeth. And some of the people, that the second category I found, is wearing the cap all the time. They lose confidence. That's why they wear. Most of them, even
but
if it is not summer,
isn't it?
it can tell that the patient doesn't have hair. But if you open the cap, they might not have hair, and they're not confident in showing their own regular natural face. It's okay to have bald. I'm telling you, it's not
appealing.
necessary.
It's about the confidence that you're carrying.
It is up to you. Yes, remove the cap and stand
just
without
be yourself.
hair also. It is fine. Most of my people say, sir, I have dark skin, I have skin texture issue, I want to be fair. So I don't promote being fair, I promote being healthy skin. This is what we teach them, this is what we tell them. See, fairness is not the category of measurement. Having a good quality and a beautiful skin is something better. And hair restoration is completely up to their personal choice. If you really want, and if it is possible for you, that you have lost hair, and you meet a surgeon, you meet a doctor that can help you regrowing your hair, regaining your confidence back, you should try it. That's what I say. So
you're just not a surgeon, I'm sure you are a great friend to your patients, building somebody's confidence that has been lost, right? So that's how I see you, Gaurav. So
whenever the patient is in front of me and they're talking and they're telling about their problem, so that particular time, if I have to understand and give him some solution, I have to forget that I'm a doctor. I have to be more of his friend to know what exactly his problem is. So a friendly approach is always required for a patient to talk.
Correct. So and that really builds that rapport, and that's another hospitality service that you're giving. It's just not that they're coming, they're paying for their services and going, but then yes, I have an appointment, I would want to go for Gaurav, right? For Dr. Gaurav. So that's something, you are a very welcoming person.
That's what I have achieved over this 5 to 7 years.
So talking about your achievements, I'm sure you bagged a lot of awards, and you are also a receiver of the national awards from like big celebrities. So how do you want to talk about that and tell us?
It all started from 2019, where first time I came to know about Indian Health Professional Awards, where we can present our cases, we can tell people that what good we have done to people, how we have transformed their life, how we have made them look from an average look to a beautiful face in achievement. So this is where I started with my first Excellence in Facial Aesthetic Award in 2019, which happened in Mumbai. I received it from our Bollywood villain Gulshan Grover sir. And in the upcoming year again there was a show which hosted in 2020, and the celebrity guest was Johnny Lever sir. So for the second time I received Excellence in Facial Aesthetics. And 2021, since there was a lot of COVID issues and things, so I could not register for it. 2022, again I got 2 nominations, one for Cosmetic Dentist of the Year, and then by then I developed a very good patient flow for hair transplant. I also nominated myself for Excellence in Hair Transplant, and I got the award for hair transplant as well. So I presented all my cases of before and after and the transformations for this award, and that's how these achievements have come, and people are started knowing me on referrals. After seeing their result, they tell their friends to meet.
It works through reference.
That's how it all started, from a very basic journey that I started from a very low salary, working from Banarghatta to Indiranagar. Yes, my clinic is very near here only in Indiranagar, and I used to come here all the way from Banarghatta at morning 9 o'clock, and I used to work till 10 p.m. sometime 11 p.m. It was a very busy clinic.
So you've seen the tough times.
Yeah, I worked with Dr. P.Y. Nagendra Kumar and Dr. Abdul Rahim sir in Indiranagar, and I've been trained very well from these doctors. They gave me an excellent knowledge how to practice dentistry, and that has brought me to this level now. So
no wonder you're also a consultant for 15 other clinics or
Yes.
hospitals today. People look up to you, look up to your suggestions, and you've been a guide, a mentor. Like you have had a mentor, you've been a mentor for all of it. So how does it feel that you have somebody as your role model, and today you're a role model to a lot of other people?
See, mostly all started with Dentomax International Academy, where first I learned and then I started teaching. So,
Gain the wisdom and share the knowledge.
Share the knowledge. That's how it started. And after sharing the knowledge, we reached multiple people like me who want to know the knowledge of facial aesthetics. And then it was very difficult for them to travel to Bangalore or to any other city. So Dr. Ashish and me, we both had planned that, okay, we will be starting to conduct these kind of academical sessions to different cities, and now Dentomax family is completely having around 15 branches across India, and we've been growing there for training and also for the surgical procedures like hair transplant or Botox fillers or any kind of facial aesthetic related surgeries to any other cities. We are having an approach. We are having people, they're wanting us to come and perform.
And that ways I'm sure you're very adaptable. Okay, I'm very curious to ask, has people ever thought you're a doctor because you look super cool?
No. Most of the people
has share some kind of an experience that
most of the people say that I am a guitarist or maybe some music fan.
I'm sure, isn't it? That really happens, because the picture that it's a doctor, they're like, wearing, I mean, with all the due respect, the way that they look,
Be
right?
professional when it's profession. That's what I believe. So whenever I'm at my clinic, I'm properly gowned.
Your Facebook or your Instagram picture says you're a doctor, but otherwise I'm sure people are not wrong.
I'm a doctor only when I'm with the patient.
The clinic.
Okay. And otherwise I'm friend to everybody. I'm having a very different personality.
Because you're super cool and very charming personality that we all know. So people get attracted to you for the way that you talk and all of it. So I always had Dr. GAURAV TIWARI, fine, but then I've always had that saying that he's a super cool doctor. So, and I really wanted to bring that side of you.
It's always there. See, right now I'm outside my clinic and we are talking here. This is something which is happening cool.
True. But apart from your, cosmetology and your dentist, your aesthetic surgeon, and I know that you also travel to different places around Karnataka for surgeries and all of that. Well, that side of it is your profession. Apart from that, what keeps you moving? And you are a self-motivated person, and I'm sure you are an aspiring and an inspiring role model to many, right? What keeps you going? I mean, what is your stress buster? And don't tell me it's your patients, while I know that you see the smile on their face after your
always I wanted to tell this one, but I don't know if it is good here or See, I saw the movie called as 3 Idiots, right? Okay. They were not 3 idiots, they were 4 idiots. Chatur was also there. So when I heard these two people stating about the train journey, तू अपनी ट्रेन पकड़ मैं अपनी पकड़ता हूँ, तो मुझे रियलाइज हुआ कि दोनों गलत नहीं थे. एक ने बोला कि नॉलेज एक्वायर करो, दूसरे ने बोला कि अपना वैल्यूएशन या ग्रोथ बढ़ाओ. करेक्ट. ठीक है. तो मैंने रांचो का ट्रेन पकड़ के अपने आप को फोकस किया, अपने करियर पे फोकस किया, अपनी पढ़ाई पूरी करी, नॉलेज को पहले हासिल किया. करेक्ट. और उसके साथ साथ चतुर की तरह I kept on focusing for my growth and achievements because we have to keep some target for us. Absolutely. So both balance करके एक ट्रेन पकड़ के गया, एक ट्रेन पकड़ के वापस आया. So this is how it went. That's a very good example. Keeping on inspiration, I always keep myself focused on growth. I keep on thinking and innovation. Always on the move. Always on the toes. Always on the move. So we should not restrict our brain and our potential. So I was never unsatisfied with my practice or with anything. I was always happy with whatever I had because I have started my journey from a very basic thing, and right now it's quite good as of now. And what I see in my future is more growth into my career, and I'm always focused on that. So this is what I say, and it keeps me moving. Always focused on growth, whatever it is. Learning is never ending. Learning is never ending. And then growth comes updating, upgrading. Upgrading your skill, upskilling. This is very important. You have to upgrade yourself, and then automatically you see that there are things going well in your life. So if you are not, you're going with the old traditional practice, there are a lot of achievements and upgrades in a cosmetic field now.
Yeah.
So I keep watching other countries,
Yeah.
other country places, other doctors, what they are doing in their country, which is not available in India.
In our country.
I try to bring those things here.
At a very reasonable rate as well.
Yeah, pricing to definitely in India we cannot charge much,
Yeah.
because most of the treatments are not insurance,
Affordability, yeah.
not insurance covered.
Yeah,
The foreign
cosmetology
countries,
and all of that is,
the
yeah.
abroad countries, they give proper insurance to the patient.
Correct.
So we have to be very reasonable for people of India, and by giving them the most advanced procedures which is available in cosmetic surgery. So we are trying the best to attain these materials from Korea, from Australia, from other different countries like Germany, Africa. So we import these materials which are used in cosmetic field, and we try to give it to people near us.
Okay.
By giving them such an upgraded service. So I always keep on focusing on learning things from different places and adapting them and applying them right now.
And helping people in India.
Yes.
Yeah, at a very affordable price. Yeah. And I'm sure your clients are also a few of celebrities, and what do you want to say, and how do you attract them?
See, what I found is when I came to cosmetic field, just for example, laser hair reduction.
Yeah.
So this is one of the thing which is very much required for a celebrity, because they are into shoots.
Yeah.
They have to be very presentable.
Correct.
Their clothing style might be such in a way that they need proper hair removal on their body. Waxing or other stuffs might
May
not
not
help
help, yeah.
them. So
And
that's
it's a
where,
time limit that they have, duration as well. When do they have the time to do?
So the people who are into modeling, into shoots, into film industry, into air hostess, so these are my regular clientele basis wherein they require these services. So targeting clients of this field only is a better thing for me. So most of my clientele basis is into modeling and aesthetics only.
Okay. So that's
This
nice.
is how it goes.
Okay, so what is that as a layman, that they can do at home to take care of their hair, to take care of their skin? So what is that tip that you want to give away?
About having healthy skin, there are so many tips that I want to share. First of the thing that I want to share you is taking care of the skin by cleaning the face very nicely. Okay. This is the first and most important thing, is your facial cleaning. So when people want to use a face wash on their face, they are not known which kind of face wash they want to go ahead. So I suggest these people to take an exfoliative face wash if they are having oily skin or an acne prone skin, and a gentle face wash if they are having a dry skin. So this is what the difference in face wash is there, that they have to be selective, and they have to wash their face at least 2 times a day, morning and evening, so that no dirt, dust or any kind of environmental oil factors, anything is depositing on your face.
Yeah.
Cleansing is the first thing. Second thing is sun protection.
Okay.
They have to protect their skin from sun damage. The ultraviolet
Sunscreen
rays,
is very
the
important.
ultraviolet rays are very harmful to the skin. These ultraviolet rays start the melanin synthesis in our body.
Okay.
So stop production. If you want to retain your color, you don't want to look dark, you don't want to get tan, please apply a sunscreen and go out. It's not a problem that you don't have to go out. You can go out and enjoy a day. You have to specifically select a good amount of SPF in the sunscreen, and you can use it. I advise usually at least 30 to 40 plus in women, and at least 40 to 50 plus in men.
Okay.
This is what the sunscreen should be.
So that takes care of your skin.
The third important thing that I want to tell people is about hydration and moisturization. This is a very, very important part. If the face has good amount of hydration, it will have glow.
Yeah.
Okay, and it will have durability. It will not become loose. It will always be firm and tight. So I advise to use a very good moisturizer in the night, gently massage your face, and if there is a ceramide containing moisturizer, it's very good, or a hyaluronic acid containing moisturizer, it is very good. So these are the 3 important skin tips that you can take. Apart from that, having healthy diet is very important. Having a healthy lifestyle, no smoking, no drinking. Sleeping pattern is the most important thing.
Very
a good
important.
8-hour sleep that I advise to my patient, that they have to have a healthy sleep. Drinking a good amount of water, at least 4 to 5, 6 liters of water if you can consume. It will keep your body hydrated, and definitely the skin quality will become very, very good. use of antioxidants like vitamin C or glutathione. These are things that can help you in maintaining a very good and healthy skin. So this is all about skin care. And for hair care, I would suggest patients to be, again, from the basic cleaning. This is what the first thing is. You should not keep your hair dirty and dry for like 5-7 days or 10 days like that. I advise people to wash their hair every 3 days at least with the shampoo, and be gentle on the scalp. Do not be excessively harsh on rubbing the scalp. This is what I advise them.
So cleaning is for them like
you have to be gently cleaning the scalp by rotating in round and round motions. And the frequency that I told is should be around 3 to 4 days, 3 days maximum. You should keep your hair. You should make your hair properly dry. You should not leave it wet for the fungus to grow on it. You should dry your towel properly before you dry your hair next time. Using a wet towel with fungus can attract more dandruff. Yes, so this is one of the things. Towel etiquettes they have to follow properly. And second thing,
they also say you can use a t-shirt for your faster drying of the hair as well, right? That is also a myth. I don't know whether it's a myth or we can
depends on availability that you have.
I guess. But the thing is, it needs to be dried. It
However,
needs to be neat. The cloth
you have to
that
tap dry. Do not excessively rub your hair. That's what I say. Frictional loss should not be there because of rubbing. This is what is the thing. And usage of oil. Most of the people ask me which oil is good. I say any oil is good, but oiling is not good. Too much of oiling is not good. 15 days once is a very good time to do oiling to your hair. You can massage your head very nicely with any oil like coconut oil, almond oil, olive oil, whatever oil you have. You can massage your scalp one night early to the wash, or maybe just 30 minutes before the wash. And in a month, 2 times applying oil and massaging your scalp will definitely help you.
I mean, this is really like a good thought about, oiling your hair once a fortnight is better, because at home, if you have like your grandmother or somebody old in the house, they'll say you've not oiled your hair and that's why your hair is not good and all of that. But then listening from you that it's good to oil over a fortnight to keep a healthy hair is really, I mean, I'm sure this is like a takeaway for a lot of people.
See, most of the people, they say that we put oil every day, every 2 days, because we want to keep it like that. But that's not good. Why? Because if you're doing over oiling to your scalp, you need more shampoo to clean it. If you are using excessive shampoo to clean it, you are making dry and the hair will break. It will not have a hair fall, but definitely you will have hair breakage. And regarding hair, since I talked about hair fall happens in people mostly because of 2 reasons. Either they have some nutritional deficiency or they have some hormonal issue. If there is a nutritional deficiency like vitamin B12, vitamin D3 or calcium or such certain vitamins, if they are less in the body, definitely the hair is not receiving these vitamins and the size of the hair
required nutrients are not,
and it exfoliates. So this is what happens with people. So good amount of vitamin, I advise them to check their vitamin levels every 2 to 3 months and check that they have adequate amount of vitamins. If not, please take supplements of these vitamins to keep your hair healthy. So this is, you need to meet your doctor, let them check why are you suffering from hair fall. And take medications accordingly so that you can prevent balding. If you are careless about hair loss, over the time you might find that the hair loss is always irreversible and it is progressive. So from a very small amount of hair loss, when you find 50 to 100,
is better than cure.
50 to 100 hair fall a day is considered normal and physiological. If you are finding more than 100, if you are finding in bunches hairs, this is something called as pathological hair loss. It means that you need to meet your doctor as soon as possible, and that's where the doctor will advise you to take some hair growing tablets or some kind of serum to apply, and over the time you might find that the hair loss is reversed. So up to a certain level only it is possible.
Absolutely.
If you are very negligent on this and you keep the hair in non-growing state for a longer time, the scalp gets closed. and the hair cannot penetrate out. That's where balding will start. And the option of hair restoration naturally with some medicines or oil or cream will not be available to you in the upcoming future. Then you might need some surgical treatment like a hair transplant or something. So rather than going to that level, start taking care of your hair in a very early stage, and meet your doctor and take some advice from him. Why are you having hair loss? Some women comes, they will have PCOD issues, they will have some hormonal imbalance. So these can be corrected by meeting your gynecologist.
Correct.
Your doctor will check your hormone level.
Yes.
They will give you some certain medications to control the hormones normally, and just by correcting the hormone, the hair loss can be reversed. So this
anytime precaution is better than cure.
So
getting
it
into
is
that
not
level
that always you require the treatment. Sometimes you need to know what is really cause of the problem.
With you. True.
So I advise them to have a regular visit to their own doctor which is nearby and get consulted and know about what is happening with them, what is the reason of hair loss, and take treatment accordingly.
Definitely, Thank you, Gaurav. So it was really good you giving us the tips about hair and skin and what's actually required to make or to look glowing and have a healthy lifestyle. In the nutshell, to have a healthy lifestyle, it actually takes care of everything, and how important hair and skin is, because skin is like the biggest organ that we have today, right? And hair is something that gives you confidence, and you have been doing a wonderful job of cosmetology, and you've been practicing that and helping build confidence in people who are coming into you. And like I said, you're a super cool doctor as well. Okay, thank you for sharing all of these tips, and thank you for being part of Coffee with Jaya with us. We're looking forward to have much more interviews with you.
Thank you so much.
For a lot of tips.
Something that I liked. I would congratulate you for starting Coffee with Jaya, and stars behind the star. That's what your tagline is. And I hope you bring so many stars in future, and let the public know that how people have changed their life, and how people are changing and helping the people to change their lives by sharing their own story. So this was my story, and thank you.
Thank you. It was a wonderful story and a very well discussion or a conversation that we had to understand your journey of life and how inspiring that you can be, and the tips that you gave us. And one takeaway that I would say is learning is never ending.
Learning is never ending.
And that's one
Always
thing.
Keep updating and keep upgrading.
Correct. And definitely just don't hold the wisdom with you, and share your knowledge.
Share your knowledge.
So that is because when you share knowledge, you have space to gain more.
Share your knowledge and share this video as well.
Thank you, Gaurav.